Welcome and thank you for joining. My name is Trixie Thibodeau, Health Educator for Community Health at Atlantic Health Systems. Today's webinar is Medication Safety and being presented by Danielle Barchi. This webinar is being recorded and will be shared in its entirety on our website. All participants are muted. If you have a question, please use the Q&A button and use the chat feature for any comments. We will try to get through all the questions at the end of the presentation. Are you or a loved one interested in a smoking cessation? Atlantic Health offers a quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about the groups and other resources, you can call 1-844-472-8499. I have also added that to the chat. Thank you and welcome, Danielle.
Thank you very much. I will just, 1 second, switch this. All right, great. Thank you so much. As Trixie said, my name is Danielle Barchi, and I'm the health education specialist for the New Jersey Poison Control Center. Today, I'm going to share some information about our services and what happens when someone calls the Poison Control Center, and some information on medication safety. Sorry, and when you may want to call the Poison Control Center related to a medication related question. So just some things to consider before we dive in. Poisoning is actually the #1 cause of accidental injury death in New Jersey. And we see that the majority of the very serious or clinically serious poison exposures actually occur in adults. So we do take a large portion of our calls related to young children because kids find things, they pick it up, they put it in their mouth. And oftentimes when people think of poison control centers, they do think of us as a resource for only young kids. However, we take calls for people of all ages, and we take calls for a range of different topics or substances. So you can see here as well that we consider a poison to be simply anything that, when used in the wrong way by the wrong person or in the wrong amount, could hurt them, kill them, or make them sick. So by that definition, pretty much every substance that we come in contact with throughout our regular day could potentially become dangerous or become a poison. Everything from, sorry, the medications we take to the food we eat, to, of course, illegal or illicit substances, the cleaners in our homes, everything that we use on a daily basis, if used in the wrong way, could potentially become dangerous. And calls to poison centers save people vast amounts of money, as well as time, because most of the calls that we take are treated at home. And in the event that somebody does need to go to a hospital, sorry, like losing my voice. Working with the Poison Control Center can actually help to decrease the length that somebody stays in a hospital, because when you call the Poison Control Center, you're immediately speaking with a medical professional. So some of the most common exposures that we see in adults, as you can see from this slide here, actually are related to medication. So whether it's over-the-counter medications or prescription medications, we see hundreds of calls every day that relate to people accidentally taking the wrong amount, taking the wrong medication, somebody intentional abuse of medications. But you can see that the majority of those calls that we take in adult exposures do actually relate to medication. Now, to dive into just what the Poison Control Center is, who we are, what we do, we are actually part of the New Jersey Poison Control Center is actually part of a network of 55 poison control centers across the United States. However, we are the state's only certified regional poison center. The New Jersey Poison Center serves all 21 counties of New Jersey. We're part of the Rutgers, New Jersey Medical School. Our physical office is located at the medical school up at University Hospital in Newark. And all poison control centers are accredited through a national organization that just actually went through a rebranding. It's now called America's Poison Centers. But what this means and why I mention this is because the information that I'm going to give you today related to the New Jersey Poison Control Center actually pertains to all 55 poison control centers. So all poison centers operate off of one phone number, the National Poison Helpline, which is on every single slide in this presentation. It's 1-800-222-1222. And whenever you call that number, wherever you are in the United States, you will be connected to the local regional poison center. So if you call that number in New Jersey, you will be connected to us at the New Jersey Poison Center in Newark. If you call it in California, you'll be connected to one of their regional centers. But all of this information is going to be pretty much the same for all poison centers. So that national organization ensures that everybody is set to a standard or held to the same standard. So poison centers and the Poison Help Hotline is available 24 hours a day, 7 days a week, 365 days a year. When you call the New Jersey Poison Center or the Poison Hotline, you will be directly connected to a medical professional, so a specially trained doctor, pharmacist, or nurse. And these doctors, pharmacists, and nurses are backed up by clinical toxicologists and then other specialists as we may need them. So if we get a call about an exposure to a wild mushroom, we may work with a mycologist who is a specialist in mushroom poisoning. We also take calls for emergency support. So usually after somebody has been exposed to something that they believe may be dangerous. But we also take calls for questions and information. So you can call us before somebody is accidentally exposed to something. Maybe the power goes out and you want to know how long the food in your fridge is going to be good for. We can take that call. So our specialists in the Poison Center will regularly be speaking to people for a range of different issues at the same time. We may have somebody who calls because, like I said, because they want to know how long after an expiration date something might be good for, or because they accidentally missed a dose of their medication. And then we may have another specialist that's working with an emergency room doctor because they're treating a patient with a multi-substance overdose. So it really does range. It's a wide range of things that we help people with. Calls to the Poison Control Center are always 100% free. They're confidential, and we can interpret calls in over 150 different languages. We use a language line, but then also a large number of our staff is actually multilingual, but we can interpret calls in over 150 different languages. So what happens when someone calls the Poison Center? I like to mention this because oftentimes when people do decide to reach out for help or information, they're a little bit nervous about the process the first time. So like I said, all calls to the Poison Center are completely confidential and free. So we will never ask any questions like your citizenship status, your insurance information, your credit card information, anything that has to do with payment. We won't even ask your address unless we need to help get an ambulance out to you. But what we will do is we'll collect some patient history and information. The reason that we collect this information is because every call to the Poison Control Center is treated as an individual case, just as if you were to go to your doctor's office or the emergency room. we're going to treat your call, your case as its own individual situation and scenario. So we need to know a little bit of your background. We'll ask how old the patient is or how much they weigh. We're going to need to collect some information on the product or substance involved. So if the name is known or how the person was exposed to the substance, so whether they ate it or drank it or they just touched it or something splashed in their eye or got on their skin, we're going to need to know the root of the exposure because obviously the information will be somewhat different. And then if possible, additional information like how much was taken or not taken. And then we may ask for information on the packaging if that's available. And then a little bit of background history on a little bit of background medical history. So if someone has any underlying health conditions, are on other medications, or things like that. And this will allow us to tailor the information that we're giving the caller specifically to the person in need. 80% of the calls, or close to 80% of the calls that we take at the New Jersey Poison Control Center are treated at home or require no treatment at all. And when we say treated at home, or, some self-treat advice, that doesn't mean that we're going to have anybody trying to advise anybody on any major medical procedures or anything like that. What we're probably going to give advice on is give the person a glass of water, rinse their mouth out, have them lay down, things like that. And then we're going to call back and check on the situation. We're going to follow up to make sure that the person, the patient is recovering nicely and that there have been no adverse effects. So just an example of a case where this might happen. We had a call not long ago where someone called in. It was a mother of a young child. She had turned her back and her toddler grabbed a deodorant stick, the father's deodorant stick off of the nightstand or wherever it was, and took a bite out of it. And it's like blue or green and it looks kind of cool, and so he took a big bite out of it, and she was very panicked. She thought she was going to have to run to the emergency room. Luckily she had been advised to call the Poison Control Center, and our advice was brush his teeth out, make sure you get all that blue or green gunk out of there, give him some water and let him rest for a little bit. Our specialist called back in about 30-45 minutes to see how our patient was doing, and he was fine and playing with his toys again. So crisis averted. She didn't waste hours sitting in an emergency room and money. We were able to help her right at home. We do, though, have cases where we will have to recommend that somebody goes to the hospital. And in the event that that does happen, we're able to help with the coordination of care. So what we're able to do is if the person is unable to get themselves to the emergency room or to a doctor, we can help arrange for transportation. So we'll contact local EMS and get them out to the patient's home. Well, one of our specialists does remain on the phone with the person in need. And if the person can get themselves to the hospital, we'll contact the hospital in advance, or either way, we'll be contacting the hospital in advance to let them know that the Poison Control Center has already triaged this case. We've gotten the medical information. We give all the updates to the hospital before you arrive. This way, when you get there, you're going right in. You're not sitting in the waiting room. We've helped to take care of that case, and you've been speaking to a doctor right off the bat, seconds after, or however long after the exposure. And what that means is that we tend to see better outcomes or shorter hospital stays because medical interaction has occurred, or intervention has started as close to the time of exposure as possible. So that's just some information on what would happen if you call the Poison Center. And then to get into talking about some medication, these are our most common medicine related calls. So while we do get calls, because people intentionally take too much medication for self-harm reasons, or because because they're having adverse effects from a medication, you can see most of the common calls that we get to the Poison Center are related to pretty simple questions, or wanting to know after a simple mistake has occurred. So, accidentally taking your medication twice or taking the wrong medication at the wrong time. I'm sorry. Taking an incorrect dose, or using the incorrect dosing route. So maybe somebody, accidentally sorry, takes the wrong medication at the wrong time. You take a medication you're supposed to take in the evening, in the morning, accidentally take someone else's medication, or take your medications too close together. These are all, like I said, just very simple questions. And these are the most common calls that we get. And they're very important questions depending on the types of medications that you're taking. As making a mistake with certain types of medication can have severe outcomes or can be very dangerous. More medications means there's more potential for risk and accident. So most adults over the age of 65 take at least 5 different prescription medications. And even this doesn't include vitamins or other types of supplements. And we do see this number of, the number of prescriptions in a house or number of over-the-counter medications. It does vary with age and time of year. Even this time of year, we see that a lot of people have different allergy medications in their home, which can be dangerous because most of the time antihistamines can cause drowsiness or increased side effects of other medications that may cause that same thing, which can make driving dangerous. We do see that medication mishaps, so just mistakes or interactions, side effects, do cause about 700,000 ER visits each year. That's obviously nationally, but it is a very serious issue. Older adults are twice as likely to visit the ER for medication problems, because a lot of times those medications that people are taking have more not severe, but may have more noticeable side effects, let's say, or maybe for more serious health issues. And older adults are more likely to be hospitalized after an emergency hospital visit, which is why we always suggest calling the Poison Control Center first before you make a final decision on whether or not to take something if you're unsure of it. So, if you accidentally, or you think you forgot to take a medication, and you want to know if you should, wait out to the second dose or take it again, we always suggest giving us a call, because there is more of a risk for interaction and dangerous side effects. Also, we get many calls for drug or medication interactions. Medications, a reaction between two medications, a drug or medication interaction is just very simply the reaction between either two or more medications or another substance or medical condition. So it could be an interaction between a medication and food or beverages, other types of vitamins or supplements. Here we have, one of the most common interactions people do think of is medication interactions and alcohol. But there are also many other different types of food and beverages that can be dangerous to mix with certain medicines. Active ingredients in different medications can interact with each other. And there are many active ingredients that are used across the board in lots of different types of medicine. So acetaminophen is the active ingredient in Tylenol. It's, like a pain reliever and fever reducer. It's also the active ingredient in over 600 different prescription and over-the-counter medications. When acetaminophen is taken in large doses, or if it's taken with other substances, alcohol, for example, it can actually cause liver damage. So when you look at a medication that has acetaminophen in it, it's required on the packaging to say, it says, has to be the first listed active ingredient, and then it also actually says on the label, liver warning. And it's because it's in so many different types of medications, so many different types of medications that you probably would think to take together, actually. So I think the best example of that is if you have a cold or you have the flu and you take Tylenol because you have a headache, and then you want to take Dayquil or NyQuil for your stuffiness and the cough and congestion and all that. Acetaminophen is the active ingredient in both of those medications. If you take that, just that one dose one time, it's probably not going to be an issue that you've doubled that up. However, if you've already been taking a medication that has acetaminophen in it for a long period of time, or you're sick for a number of days and now you're tripling up this active ingredient, that's when we start to see potential issues, especially in younger children. We see that, or if you're taking it for a long term and then also mixing with alcohol or something else that could be dangerous, we see problems come up from there too. Interactions typically, drug interactions typically can decrease how well a medication works, or it may increase unexpected side effects, or increase the possible toxicity of a drug or medication. So I'm so sorry that I keep clearing my throat. I'm all stuffy. Some examples of this might be if you take an allergy medication, like I said, like an antihistamine, but somebody's already taking an anti-anxiety medication. Both of these medications, they can cause drowsiness, so they're going to increase the side effects. The person may just become extra drowsy. We see a huge problem with this now if the person goes to try and drive a car. You can actually get a DUI for drug driving because of medication interactions. If you're drowsy and you're under the influence of medication and you get pulled over, this may that is an issue. We this time of year, we oftentimes will warn people, know about the side effects of your allergy medications and how it may interact with other medications you're on, because we do see an increased number of drug driving cases this time of year. Like I said, with the acetaminophen, that's an example of increasing the toxicity of a drug or medication. And if these interactions occur for a long period of time, or if it's an interaction between two different medications that may have a very serious side effect, the outcome can be incredibly dangerous or even deadly. These are some examples of the different types of interactions. So like I said, drug and food and beverage is one most people are very aware of, but it would be anything like I was explaining with the acetaminophen and alcohol. One that's always kind of interesting is that St. John's wort and the pill or any form of oral contraception. St. John's wort actually reduces the effectiveness of oral contraception. We see problems with grapefruit and statins. It's why a lot of times, on certain medications, you'll be told to avoid grapefruit or grapefruit juice. We see drug and drug interaction. That's the example, like I said before, of the acetaminophen or any other type of medication where the two may have a negative interaction with each other. We even see drug and disease or medical condition interactions. An example of this may be if you are if you're on blood thinners, you're often told to avoid leafy greens or vitamin K. And the reason for this is it can increase the risk of blood clots and stroke. So these are just, like I said, a couple of examples. We do see that an increased amount of medicines in the home increases the risk for unintentional injury and overdose. We suggest that that you clean out your medicine cabinet or the medications in your home twice a year. The DEA does run a drug take back day in April and October. This year's April event actually occurred last Saturday on April 22nd. But what you should do is any of those expired or unused, unneeded medication should be taken out of the home and properly disposed of. If there is not an event coming up, you can often bring your medications right into your local police department. Most of them will have a box in the lobby. I know in my town, it's an old mailbox where you can just drop off your medications and then they'll properly be disposed of. And this helps to make sure that, you're not, someone's not getting into your trash and taking medications that they may find, or that they're being improperly disposed of, which can be harmful to the environment or animals in the area. So we do recommend cleaning out your medicine cabinets when, like I said, twice a year. We do also see a lot of calls related to opioids. And it's important for people to know, if they're being prescribed these medications, just how dangerous they potentially can be. Anything that you would get from your pharmacy should be safe to take as prescribed by your medical professional, meaning that it should not be, there shouldn't be a concern of it being tainted with anything else. However, do have an understanding of what you've been prescribed. Talk to your physician about it. If you're uncomfortable taking a certain type of medication, make sure that you speak with your doctor about that and possible alternatives. This is also something that our specialists at the Poison Control Center can help with. So let's say you or someone in your family is prescribed an opioid for pain, and you're concerned about that, that's something we can definitely help out and advise on, just, by providing the medical information on that, on what was prescribed. We may be able to help identify some possible alternatives, and give information on some things to look out for.
Okay. Okay, there's one that says, take a sip of water. Maybe it was probably meant to go into the chat.
Okay. All right. Any other questions?
Let's wait a minute or two and see if anybody else comes with any questions before we end for today.
Let's go back to the first.
Okay. No, it doesn't look like we have any other questions coming in. Okay, well, we will end for today. Thank you for joining us. We kindly ask that you take a few minutes today, webinar, and complete the program survey, which I have put in the chat area for you. The link to the survey will be there, and also the 800 number. If you have any additional questions, you can also email us at communityhealth@atlantichealth.org. That is also in the chat. Everyone have a great day, and hope to see everyone soon again. Thank you.